So welcome to ICBioMed 2025. So my talk is recent advances in multimodal neuroimaging data analysis, as well as the recent clinical applications. So I'm Wang, associate professor in Auckland Bioengineering Institute, as well as faculty of medicine and health science from the University of Auckland, New Zealand. So the content of today's presentation include the three major parts. The first one is the multimodal neuroimaging data analysis, especially the methodologies recently developed in our group. The multimodal neuroimaging data actually includes structural MRI, diffusion intense MRI, functional MRI, and other modalities in the EEG. So we focus on the neuroimaging data analysis as well as CT and PET, etc. Then followed by the clinical application. So focus on the neuroimaging data analysis, and also the application could include the rehabilitation and also the prognosis, the diagnosis of neurological disease, especially for the stroke. Followed by the last part, which is the discussion and the conclusion of today's presentation. So the first work is our recent paper published in Medical Image Analysis, which is a recent research trend that is to integrate language into medical visual recognition and reasoning. We know that vision language models, in short, is VLMs. I think that this kind of vision language models are very efficient paradigms that can build a bridge to make full use of the visual perception as well as the textual interpretation. So previously, most of the neuroimaging data analysis are mainly focused on or medical imaging data analysis are mainly focused on the imaging itself. So they underutilized the textual information. So the medical vision language models have triggered more and more interest, but attract a lot of researcher attention. So not only include the self-supervised learning in the pre-training stage, but also introduce the auxiliary information. And for example, the radiological report or historical report into the medical visual perception. So on the right side, this is the general diagram for the vision language models within the applications for medical field, including medical imaging data, medical record, which is really multimodal, then include the classification of neurological disease, for example, in neurology, or the segmentation detection. Regarding the neuroimaging data analysis, so segmentation is often involved, which could be from a single modality, for example, diffusion-weighted imaging data. This is a pipeline to perform automatic lesion segmentation, followed by the quantification of the lesion. The lesion could be the stroke lesion, or could be the other lesion, for example, the brain tumor, etc. And the lesion, sometimes the lesion are quite big, as shown in the previous slide. Sometimes the lesion could be quite small and quite distributed in different locations of the brain. But within this kind of scenario, the machine learning or deep learning method can be very helpful to identify this kind of small lesion. For example, for the microbleeds. So microbleeds, the image from the imaging, neuroimaging, for example, MRI data, we can see that the microbleeds, the appearance of microbleeds could be very similar to the appearance of vessels. So we need to consider the spatial coherent information to identify the microbleeds properly. But the challenge is that the microbleeds could be located in different could be quite sparse. So we proposed machine learning based what we call the independent subspace analysis based on the hierarchical features to identify the microbleeds in a robust way. So the accuracy and also the sensitivity for the segmentation could be quite high. For example, the sensitivity could be 89%. So the most attractive part is the automatic detection of the microbleeds. For the data from multi-center or the multi-site, we propose the concept of harmonization, means that the MR data, we know that MR data normally is the intensity values within MR images are relative values. It means that from different MR scanners, the intensities are not comparable directly in a direct way. So we need to perform some pre-processing, for example, harmonization, so that the scanner difference or the imaging device difference could be removed. So we focus purely on the imaging itself, purely focus on the content. So this is the diagram. We propose to perform the structural harmonization for MR data. So the similar strategy that can be applied on other advanced modalities, for example, DTI, functional MRI, arterial skin labeling. All the advanced analysis method can be utilized in analyzing diffusion tensor imaging, and by performing the proper fiber tracking, we can extract the specific fiber bundles, for example, the cortical spinal tract. So by analyzing the fiber tracks, we can extend the fiber tracks and project the extended fiber tract to the cortex. Then this kind of projection can be utilized to map the proper functional region related to the specific fiber bundles. So this kind of diffusion tensor imaging driven functional region analysis is very useful for the surgical planning or navigation, especially for those patients who can't perform the proper task-based paradigms. Multimodal MR analysis can be utilized in different clinical issues. For example, here we applied multimodal MRI to analyze the brain changes for MTBI, which is a mild traumatic brain injury, which is quite common for the rugby players. So in New Zealand, rugby is very popular in middle school, in college, and also the adults. So this study, we utilize MRI. So this study is a longitudinal study. So we include 36 male high school rugby players across the season, with multiple MR scans. We include the 3D T1 MR data and also the multi-shell diffusion MR sequences. Besides the rugby players, we also include 20 matched controls. So regarding the structural MRI, we found no difference, no significant difference with, for example, the volumetric measurement of the subcortical brain structures. But within the diffusion tensor imaging, the other modality, we noticed some substantial differences in mean diffusivity and axial diffusivity within the two groups, that is the rugby players and also the controls. The diffusion metrics such as AD or MD and also RD, radio diffusivity, within the certain brain tracts demonstrate a strong correlation with the symptom severity. Means that the higher symptom is more severe, then the difference as shown in AD, MD, or RD is more obvious or more significant. So this is our recent one of our studies to utilize multimodal MRI as well as the quantifications for mild traumatic brain injuries. This is another example for the recent advanced methodologies to analyze the other neuroimaging modality, which is the functional MRI or the EEG, because this kind of data are temporal data. We call this spatial temporal data. There are a lot of time points, so each time point is a three-dimensional data, so we call this kind of temporal spatial data. So we propose to utilize the brain-inspired spatial temporal spatial neural network analysis to analyze the neuroimaging data and perform the classifications of different mental states or different neurological or mental health issues. So this, we know that our brain functions as a spatial temporal associative memory. So inspired by this kind of capability of a human brain, so a brain-inspired spatial temporal associative memory was proposed that utilize the NeuCube, that is one of the spatial neural network framework. We performed some pilot study that demonstrate that the development of classification systems on the other neuroimaging data, for example, the longitudinal MRI data, trained on the complete data, but we can find the attractive part of the NeuCube brain-inspired spatial neural network can recall the result just based on the partial data. So we call this brain-inspired spatial temporal associative memory for temporal neuroimaging data analysis. So if you have interest to know more about this kind of brain-inspired neural network, you can read our recent publication as shown at the bottom of this slide. For the neuroimaging data analysis, based on the segmentation, we can quantify the normal brain structures. We can also quantify some lesions within the brain. So the quantification could be direct report, for example, some metrics like the volume and the diameters. If we want to incorporate the prior knowledge, we can utilize some brain atlas. As shown, for example, in this slide, this is one of the atlas we constructed, which is Albert Stroke Program Early CT Score Atlas. Normally, we call it aspect. So, but the aspect, the original definition is based on CT. But within the more adoption of MR imaging data, we found that MR also need to have this kind of atlas. So we developed such an MR version of the aspect. We call this aspect MR atlas. And the atlas could be based on the gray matter and the white matter information. Even the fusion of the gray matter and the white matter information, we can put them together. We call this kind of a hybrid atlas. This atlas is utilized for the stroke, analyzed for the stroke lesions. The integration for the multimodal, mentioned the multimodal imaging data several times. So for the visualization, sometimes from different imaging modalities, we can find a different information. So this kind of information could be quite complex, could be support the diagnosis from different perspective. Then we needed to integrate them together to facilitate the diagnosis. For example, for this slide, on the left side, we can see the lesion from the one imaging modality. On the other side, we can see the vessel more clearly, but they are separate. They need to rely on our human being's imagination to think about, to imagine the relationship between the lesion and the vascular. Then we propose a method to fuse the data. Then we perform the visualization. As shown on the right side, we can see the lesion, and also we can see the vascular structure clearly. And also we can manipulate the data. We can rotate, zoom in, and then the relationship between the lesion and the vascular is so obvious. For the other recent development include the pseudo data generation. Actually, we call this called synthetic neuroimaging modality generation. The reason this kind of artificial AI technology is helpful for neuroimaging data is that, for example, we may easily have the CT data for the acute, for the emergency department for some patient, for example, stroke or injury. But the analysis or the quantification, we may have more interest to analyze the soft tissue, which is much more obvious from MRI. Then the question is that can we generate the MRI data based on CT? Then this kind of generation can be very helpful for the diagnosis. So we proposed the concept deep learning based on the deep learning models to generate the pseudo or synthetic MRI from CT. As shown on this slide, we compare the different deep learning based methods, different models, and also you can see that the generated pseudo MRI or synthetic MRI is quite comparable to the ground truth MRI. So, and also it's so convenient for the radiologist to look at the MRI data, even the pseudo MRI data. And also we can provide the CT data as a validation or further comparison. Based on the generated or the real MRI data, sometimes we need to align the neuroimaging data from the original space or the personalized space to the standard brain template atlas space. Then we need to rely on the registration. But the research question or the real world problem is that for those patients with significant lesion occupation, the registration from the patient data to the standard brain template atlas may not be accurate because the lesion, there is no corresponding lesion in the template. So it means that the registration could be very challenging, especially for the non-rigid registration. Then we propose a new method to address this problem by filling in normal tissue for the region with a lesion. Then the brain may look like a normal region. Then this will facilitate the registration, especially nonlinear registration from the personalized space to the brain template and atlas. So our experimental results based on the ICBM brain template registration show that this kind of lesion imprinting can really improve the registration accuracy. There are also other advanced analysis, for example, the simulation to analyze the vascular images, for example, the intracranial aneurysm using computational fluid dynamics, and also based on the brain template or atlas or the personalized neuroimaging data, we can design the protocol for stimulating, for example, using the TMS, transcranial magnetic stimulation, to perform the brain stimulation. So we developed some new coils, we call the array coils. Normally it's just one or two coils. We provide a new design of array coils for multi-target MRI magnetic brain stimulation. This is our experimental results, demonstrates the capability. And also the imaging data can be utilized to perform the navigation or planning and navigation for the intervention, such as the TMS or and other stimulation. It could be a magnetic or electrical stimulation. And based on the multimodal neuroimaging data, there could be a lot of applications for diagnosis or prognosis. So here this slide demonstrates our work based on imaging data to predict the motor function after stroke, for example, 6 months or 3 months after stroke, the motor function. So the current prediction, we mainly focus on the mid to long-term symptoms for the stroke. So we are currently working on based on the advanced multimodal MR data and also other available information. We want to predict other scores. For example, scores of the motor function, language capability, the visual spatial attention. So this kind of scores will be more quantitative and also will provide more precision uh, uh, rehabilitation in a convenient way. For the rehabilitation, we also developed some augmented reality-based application and also automatic object detection and put them together. So develop the gamified assessment and rehabilitation for spatial neglect after stroke or brain injury, for example, the TBI. So we can see that neuroimaging, especially the multimodal neuroimaging data, plays a very important role to understand, for example, the post-stroke recovery and also other neurological disease as well as the rehabilitation. So the advanced analysis method, deep learning, machine learning, connectivity analysis can enable the meaningful information extraction. And the neuroimaging biomarkers, especially the multimodal neuroimaging biomarkers, for example, the lesion and the lesion quantification, connectivity, and functional information can be integrated together to improve the prediction accuracy. So the intelligent neuroimaging analysis has a lot of applications in the early diagnosis or prognosis. The conclusion for this talk is that the neuroimaging, you can see that plays a very important role to understand the brain injury and the recovery, and artificial intelligence and the machine learning techs can enable us to have more intelligent predictive modeling. And the intelligent multi-model neuroimaging analysis can support early decision making and personalize the treatment plans and also improve the outcome for the patient. Regarding the future direction, I think that it will be including the following aspects. The first one, the multi-center data harmonization, especially for neuroimaging data. I mean the neuroimaging MR data, and the interpretable and the trustworthy AR models, and the integration of AR or VR for real-time patient feedback. Again, it's very important that we have the collaborative efforts because they are very, very important to translate research innovations into routine clinical care or clinical practice. So I want to finally acknowledge our collaborators and also the funding agencies. Thank you.